I'd just like to tell you about a group I chair called the Service User Reference Forum, or SARE for short. It's a group of people who represent the views of people living with dementia, our carers and families across the city of Liverpool. We want to improve the quality of life for people living with dementia, our carers and families, and to make Liverpool a dementia-friendly city. Our aim is to help people living with dementia and our carers have a voice and say on services, plans and decision-making within our city. We want to involve people living with dementia and their carers to interact with Liverpool City Council, Liverpool Clinical Commissioning Group and other organisations in planning better services. We also want to be consulted on future developments of our health, social care and other services in Liverpool. We want to ensure that people living with dementia and our carers are kept informed about services that affect us. We want to let service users and providers know about dementia and what is it like.
Yes, hello, this is Chris Norris. I'm a member of the Kent Forget-Me-Nots group. We all have a diagnosis of dementia. The group is very proactive in getting the word out there that it's possible to live well with dementia and to actively have a positive influence on all aspects of thinking around the subject of dementia. We do this by speaking at seminars, CCG groups and health authorities. We recently gave a series of 12 presentations to GP surgery receptionists and pharmacy staff on how they could improve the interaction and understanding between those people who are working on the front line and who are the first point of contact with those affected by dementia. Where we then put forward to each audience possible solutions to the challenges that those with dementia experience and ways to achieve a better interaction. A great amount of progress has been made in recent times within the sphere of dementia in standards of the services provided, in the communication between providers, users and in society's understanding of the condition. The challenge now is to maintain the forward momentum, but with the willingness and determination of all parties involved, the possibilities are endless.
The other meeting that I went to was about the future of dementia services in Liverpool, and it was for them to ask us to be involved in the development of a new facility for people living with dementia. A huge move forward to involve service users, working alongside them to ensure that a view of somebody living with dementia is taken into consideration. So it's really exciting. There's already huge changes. They've built a new centre in Liverpool, and it means that we can hopefully make a place of excellence for the future.
If I could pick my favourite people to speak to, it would be to students. All students are like a sponge waiting to soak up knowledge and information. I've spoken to student nurses who can change the way we're treated in hospital, to student journalists who can change the way we're perceived in the media, and today I was contacted by a broadcasting media student who will be able to change the way television portrays people with dementia in the future. Talking to students, their youthfulness and naivety hides the enormous role they can play on future practices and acceptance of dementia in the future.
After I had had my diagnosis of vascular dementia, all my family and close friends were unbelievably supportive. However, two now ex-friends, one of whom is a teacher in a college, didn't believe I had dementia and began to mock me. They would make fun of things I did, especially if I forgot something. They'd call me names and laugh or sneer. Of course, they must have thought it was funny, a bit of a joke. I laughed. Little did they know it was crumpling me up inside. Their hurtful remarks ringing in my ears for hours. Of course, at that time, I had no help, no one to turn to, but I have now. Being a member of the Stockport Educate group, our aim is to educate people with every bit of information that is available and hopefully pass that correct message on.
If I was to promote one type of support For those newly diagnosed with young onset dementia, it would be for peer support. There's nothing I find more comforting than for someone else to say that they're experiencing the same symptoms. It enables you to share coping strategies and helps to alleviate isolation. But it's so difficult to identify and encourage those who would benefit from such support. That's why I love attending Minds and Voices in York, a group for people with dementia to get together and enjoy friendship and laughter.
I'm back from presenting the sensory booklet at the ADI conference in Budapest. Wow, I wish all of you could have been there. The feedback from the conference that we were hearing was that the sessions that people with dementia were presenting were the best, and that came from the professionals. We need both at these conferences, but our associations should be putting their hands in their pockets and sending people to represent them and their carers at these conferences. It changes the whole atmosphere and makes the conferences better. The sense of excitement, I wish we could bottle that and give it to other professionals. The collaboration where people's voices with dementia and our supporters and carers were listened, and where we listened to what the professionals were saying to us. A true collaboration, true partnership, working together.